on rape victims in Maryland to know which hospital to go to for the exam needed to make a case against an attacker. Now, for victims who show up in the wrong emergency room, the most traumatizing experience of their lives could have just gotten worse.
Now a new law aims to cut back on what some are calling a flawed system. And although everyone wants the best for the victims, not everyone sees eye to eye on the new rules. Imagine the horror of a rape.
A lot of people don't want to speak about it, and there's a lot of shame around it.
But even after an attack, the confusion and perhaps hardship isn't over. In Maryland, there's about one hospital per county staffed with specialized nurses. They're trained to examine rape victims and collect evidence meant for prosecution.
It's a humiliating process. Unfortunately, to get successful convictions, you need that evidence.
For Kate Rush Cook, it was 11 years before a conviction. She was just 20 years old when she was kidnapped, repeatedly raped, and strangled. Later that same night came the exams, the rape kit, the next steps in making sure the evidence was there.
There's so many things that can devastate you down the road and re-traumatize you if they're not done properly.
But she says not knowing which hospital has the trained forensic nurses could add to the already horrifying experience.
I was in a ride-along with a firefighter, and we got a call from someone who had been raped and was taken to the wrong hospital. They were taken to the local hospital that I knew wasn't the one that provided sexual assault services. So when that happened, it was sort of like a big light to me that said it's time to introduce this bill.
A bill now turned law, requiring all Maryland hospitals to have a protocol, a plan of action on how to handle rape victims who walk through any emergency room door.
In some cases, rape victims would be turned away and told, you need to go to this other hospital down the road, and there was no process in place for getting them there seamlessly in a supportive way. In other cases, they might have been treated by a provider who was not well trained to do that treatment, to do the forensic exam.
The law isn't a one-size-fits-all. A hospital's protocol could be simply transporting the victim to the right location. Delegate Ariana Kelly sponsored the bill and says for a rape victim, the mere fact of being told you can't be treated at the hospital where you showed up could mean turning away altogether.
It still horrifies me. I've been doing this for over 20 years. It's the reason why I got into it was because of the healthcare response. Yeah, it's shocking to me that if you don't know the rules, if you don't know the inside system, you're probably not going to get a forensic nurse. Not yet, at least.
Carrie Gorel is the CEO of the International Association of Forensic Nurses. She says the issue goes beyond just how we're handling rape victims. She says across the board, forensic nurses are needed, full-time, full staff, and at every hospital.
Forensic nurses, the skills that they have are really universal to all victims of crime. And so whether you've been hurt in a car accident, hurt by your partner, whether you've been hurt by a parent, a dog bite, a slip and fall, all of these things, there's a criminal or civil criminal justice component, and there's a medical component. And whenever you marry those two, you want a forensic nurse to be there.
But supplying these specially trained nurses comes at a cost. On average, training runs around $2,000 for sexual assault nurse examiners.
Unless you're looking at grant funding, some kind of federal or state funding, no one is yet willing to put upfront the cost for the training and the on-call time. It costs money. If you're not going to have a full-time forensic nurse staffed in your ER 24/7, then you're going to have on-call time for the nurse to 365 days, 24 hours a day, be willing to drop everything and come to the hospital.
But some hospitals say the current plan is fine as is.
I really feel it's a step backward, and right now we already have a good plan and process in place that's been working well since 2006 or prior. I'm not sure why we want to change it.
Dr. Cynthia Bookman-Webb is the chief of the ER department at MedStar Union Memorial. Their hospital is one that typically doesn't perform the sexual assault exams, but they've got a plan in place to complete a medical screening, then provide the transportation to a designated hospital.
Once we explain the process, even if initially they're like, we're not sure if we want to go, once we explain the fact of all the resources that they have and the fact the best place to have that forensic exam done is where with a specialist, that that's all that they do, then they understand why we're doing it and they do not have a problem with going down.
She says they only see a handful of sexual assault victims each year, so changing their policies and perhaps training their own staff might not be as beneficial as sending victims to a hospital specifically focusing on sexual assault cases.
It's not so much the cost, because once again, it's a pretty rare event. It's more the collection of that evidence. So if you're not used to doing it, that collection of evidence and that chain of command, it's very difficult to remember all the details and all the steps that have to take place.
But not everyone agrees.
The protocol could still continue to be transfer the patient to the nearest designated safe hospital. And if that hospital is 2 hours away in traffic, it's not going to change things right away.
But Gorel says therein lies the problem. There's more than 5,700 hospitals across the country, but there's only a little more than 700 programs to properly handle collecting evidence on rape victims.
If you look at it one-to-one, which isn't always a one-to-one, it's about 13% of the hospitals in the United States might have a forensic nurse part of the time. For
Delegate Kelly, it's a step in the right direction, a way to get the word out about where to go or simply how to help.
It was just incredibly frustrating for me to know that the system, which wants to help people, wasn't able to do so because of these really administrative and procedural roadblocks. It was clear to me that it was the system that needed to be changed, not the people who were on the ground trying to help folks who need help.
Now, every hospital in the state has to submit their plan of action by July 1st. A planning committee will review the protocols and decide whether the plan is acceptable and perhaps what recommendations or changes need to be made. Delegate Kelly says since the rape kits are federally funded, it's really no added cost to the state. A previous ABC2 investigation revealed that the Department of Health and Mental Hygiene shows hospitals were paid $2.9 million in rape kits reimbursements over the past 3 years. We took a look at the national numbers of rapes and the hospitals providing services for victims. We have that full story on our website. That's abc2news.com/infocus.